going to be a video for a sterile wound changing. Before I entered the room, I would have identified the wound care plan and would have grabbed the appropriate materials. I'm going to set those down right here for now. I'd assess the need for PPE and put on the appropriate PPE. For this, I'm just going to say standard contact precautions. Gloves. Well, I'm going to prefer hand hygiene first. I would identify the patient. Hello, Mrs. Smith. I'm going to be doing a sterile wound changing on you. I identify the patient. I would check an ID band. And then I would. Are you in any pain today? After that, I would apply any pharmacological or non-pharmacological treatments I could. I have a trash can right down here. Okay, well, I'm going to remove your wound dressing now. I'm going to lower this as low as I need to. I'm going to raise your gown now. I'll check any nearby drainage or tubage. Well, I need to raise my environment first. See if I can get it up to elbow height. That's good. I'm going to lower this. Okay. Now I'm going to remove the dressing using the push-pull method. I'm going to push on the skin and pull away on the tape. Just toss this in the trash. I would check to see if there's any drainage upon the dressing. I would use taco, type, amount, color, and odor. Toss that in the trash, but I'm just going to put it to the side for now. Then I would assess the wound itself with taco, and then I would measure the wound. I would go by whatever standards the facility I'm at sets. For now, I will just measure the length of the incision, which is at 4 inches, and the width of the incision, which is at about half an inch. Okay. Now I'm going to get all my supplies prepared. Perform hand hygiene again. I'm going to set out 4 pieces of tape, 2 short, 2 long, and then another piece of tape, and write my initials, the time, and the date on that one. down now. My initials, the date, which is the 5th of February, 2025, and the time, which is about 2-ish. I will write down well, I have a watch. 2:34. p.m. Okay, I'm going to lay out my sterile field now. My keychain did dip into the sterile field, so I would redo it at this point. Matter of fact, I will just take that off for this. I'm going to open all of these, and I'm going to drop them into the sterile field. Did touch the sterile field with that wrapper, so I would redo it at that point as well. I will open this, which I suppose I will do. At this point, I will put on my gloves. Okay, starting with my non-dominant hand, grasp the outside of this glove. Finger into the cuff of this one, raise it up. Okay. Now I'm going to take the swab, apply whatever the wound care plan says to apply. Dab, 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 dab. Okay. Trash. 2 gauze pieces. Then I will apply the abdominal pad with the blue line facing up. Put on my tape. Place the identification upon the top of the pad. At this point, I will gloves, throw them in the trash, put them right there. Then I will pull down the patient's gown. Pull up the blanket. Okay, are you feeling any pain or are you in any discomfort? Is there anything I could do for you? Throw all of this away. Throw all this away, but I'm gonna save it. Then I will lower the bed. To its lowest setting, lock the bed. I will raise this side up. Okay, and I would make sure that this dressing gets changed every shift or whenever the order says to change it. Then I am done. I will perform hand hygiene.